This muscle is the tensor fasciae latae. The origin is the iliac crest, the lateral surface of the anterior superior iliac spine. The insertion is the iliorbital tract. The action is the extension of the knee and lateral rotation of the leg, adduction and medial rotation.
What muscle was that?
The tensor.
No, like where on the leg?
Oh, this one.
Oh, beautiful, beautiful.
Yeah.
You are so smart.
This one is the gluteus maximus. The origin is the iliac crest, posterior gluteal line, lateral surface of the ilium, sacrum, coccyx, thoracolumbar fascia. The insertion is the iliorbital tract and gluteal tuberosity of the femur, and the action is the extension and lateral rotation at the hip. It is this muscle. Next is the rectus femoris, which is this muscle, the one in the front. The rectus femoris, its origin is the anterior inferior iliac spine, supraacetabular or whatever groove. The insertion is the tibial tuberosity in the patella. The action is the thigh flexion. That's that one. Next is the biceps femoris, which is back here.
Awooga.
Awooga. The origin is the ischial tuberosity. Insertion is the lateral head of the fibula. The action is thigh extension, knee flexion, external rotation of the hip and leg. That one. Number 5 is this muscle right here, like this one muscle. That's the vastus lateralis. The origin is the intertrochanteric line, greater trochanter, gluteal tuberosity, linea aspera of the femur. The insertion is the tibial tuberosity or the patella. The action is the knee joint, is at the knee joint, it's the leg extension. Next is the gastrocnemius, which is back here. The origin is the lateral condyle of femur in the area.
I think the gastrocnemius is the one that looks like a hunk of meat. Turn.
This one?
The little tiny one. This.
But look at here.
That's what I had.
I think it's right here. Because this one is,
Number
it is.
6.
It's the whole, it's this. It's the whole backside.
Look at 6.
Yeah, but look at 6 right here.
Yeah.
It's the whole, this one and this one. It's one. Okay, the origin is the lateral condyle of femur and area above the condyle. Insertion is the posterior calcaneal tendon.
Yummy.
So this, right? The action is plantar flexus the foot. Number 7 is the soleus. That's this little part right here. You can't really see it. You want to zoom in? Like right here, there's a line right here, and it's underneath the gastrocnemius. It's right here.
Awooga. Very nice. Very nice.
It's called the soleus. The origin is half of posterior surface of the tibia along the soleal line, so I'm assuming this is the soleal line. Insertion is the posterior caniculus via canicular tendon, so it like hooks in with it. The action is plantar flexus foot, so it's pretty much the same as the gastrocnemius. The tibialis anterior is number 8. That is right here. Right here. The origin is the lateral surface of tibia interosseous membrane. The insertion is the medial cuneiform bone, base of metatarsal bone number 1. The action is foot dorsiflexion and foot inversion. Next is the fibularis longus, which is this one. The origin is the head of the fibula, proximal 2/3 of the lateral surface of the fibula, intermuscular septa. Insertion is the medial cuneiform bone, metatarsal bone number 1. Action is foot plantar flexion, foot eversion, and it arches your foot. Number 10 is the extensor digitorum longus, which is this bone, or this muscle, whatever. The origin is the proximal half of the medial surface of the fibula, lateral tibia, tibial condyle, interosseous membrane. The insertion is the distal and middle phalanges of digits 2 through 5. Action is toe extension, foot dorsiflexion, and foot eversion. Number 11. I'm gonna turn the leg this way.
Ooh.
Number 11 is the adductor longus. That is this one. The origin is the body of the pubis, inferior to the iliac crust and lateral to the pubic symphysis. Insertion, the middle third of the linea aspera of femur, it's basically the medial hip. Action is thigh flexion, adduction, external rotation, pelvis stabilization. Number 12 is the gracilis, however you say it. Number 12 is, it's like this bigger one back here, I think. Yeah, it's this one. The origin is inferior ischiopubic ramus and body of the pubis. Insertion is the medial tibia at pes anserinus or something. Action is it flexes the knee and adducts the thigh medially, rotates the tibia and femur. Number 13 is the adductor magnus, which is right here. The origin is the ischial tuberosity. Insertion is the adductor tubercle on medial femoral condyle. In the action, it adducts the hip through and thigh flexion. Number 14 is the sartorius. That is this muscle, like the little one. The origin is the anterior superior iliac spine. Insertion is the proximal end of the tibia below the medial condyle. The action is thigh flexion, abduction, external rotation. Number 15 is the semimembranosus.
Dinosaur.
Same thing. That is this muscle back here. This one. The origin is the superolateral impression of the ischial tuberosity. Insertion is the medial condyle of tibia. Action is thigh extension and internal rotation. The semitendinosus is also like there's a line right here. So the last one was the first, like the front one, and this one is the back one.
Nice.
The origin is the ischial tuberosity. Insertion is the proximal end of the tibia below the medial condyle. And the action is thigh extension, thigh internal rotation. Number 17 is the vastus medialis. And that is this one, this big chunky one. The origin is the intertrochanteric line, spiral line to the medial lip of the linea aspera. Insertion is into the side of the quadricep tendon, rectus femoris, patella, and tibial tuberosity. The action is that it extends the knee and it like corrects the tracking of the patella, so it like keeps it in. So yeah, that's that.
Amazing.